Hello and welcome back to Transvox. And sitting in front of me today, two people who knew technology could be so marvelous. I'm joined by Abigail Parkes, who has been on this podcast before. In fact, I've developed now a special hook to make sure that we can drag her out of the frame so everybody else can get a word in edgeways. Hard just saying Abby. And most delightfully, Emma Leatherbarrow, who has joined us from the Wessex Cancer Alliance, which is part of the NHS. So let's just do some quick introductions, and we're going to talk some really interesting stuff around cancer, around trans people, around some new initiatives, and pushing the frontiers of all that is possible within this Star Trek universe. So first of all, welcome, Emma. How are you?
I'm very well, thank you. Thanks for inviting me on.
You're very welcome. And Abby, lovely to see you again.
Hello, lovely to see you too.
Good. Look, for those people that don't know, just tell us a bit about yourself, Abby, and the organisation you work for.
Yeah, I work for Beyond Reflections. We're a charity that supports trans, non-binary and questioning people. I do all of our kind of outreach, fundraising, all the fun stuff is what I normally say. I think everybody else's job is a bit boring.
What, producing results. Brilliant. Thanks. Lovely to see you again. Emma, tell us a bit about yourself and the organisation you work for.
I'm Emma Leatherbarrow, and my job is Inequality and Involvement Lead for the Wessex Cancer Alliance. So we're a bit of the NHS that's responsible for improving cancer care for people. Cancer is a really big subject, and I know some people find it really hard to talk about. Most of us have been affected by cancer, either personally or people that we love having had cancer. And it will affect 1 in 2 of us in our lifetime. A big part of my job is making sure that people receive fair and equitable cancer care and that they get the best possible outcomes. But what we know is that some people are more likely to be diagnosed late, and late diagnosis of cancer generally means there's fewer opportunities for treatment and often poorer outcomes. So it's really important that we get people into screening that's appropriate for them, and building their awareness of cancer signs and symptoms, so they've got more chance of getting an early diagnosis and a much better chance of surviving and living healthily beyond their cancer.
People talk about this sort of early diagnosis thing. Is it really a game changer?
For some cancers, it's a massive game changer. So for bowel cancer, for example, it's a really significant difference between being diagnosed at stage 1 or being diagnosed at stage 4, so a later stage bowel cancer.
Yes.
With 90% of people not surviving their cancer if they're diagnosed late with bowel cancer, but 90% of people surviving if they're diagnosed early. So it really is a very profound difference.
Yeah, that is significant.
For some cancers.
Yeah. And why should trans people be interested in cancer, Abby? What's the significance of this with regard to trans people?
I think Emma will probably know more about this than I do, but that trans people are in one of those groups that tend to get diagnosed later in later stages and tend to present at A&E level rather than at GP. And also that a lot of kind of the more gendered cancers can be avoided, specifically related to dysphoria, or even just not knowing what screenings people need, issues with kind of gender markers and stuff like that, meaning that you don't automatically get messages about the screenings that you need. So lots of different complicated stuff.
Interesting. So are you saying that trans people are less likely to turn up to screening, which means that, as Emma says, the chances of good treatment and is the issue? Is that part of it? Is there a specific reason for that?
Yeah, I think, so screening is a big issue. There's specifically with cervical screening, I think is a big issue for trans people because obviously it's quite an invasive thing to do. Even cis women don't enjoy a cervical screening, I don't think, as less enjoyable if you've got a lot of dysphoria around there, or a lot of people are worried about their gender not being respected during that procedure.
Okay. And I think that's a really important issue because I think the automatic call and recall system doesn't work terribly well for some of our screening processes, which means some people may not be routinely invited for their screening without having to opt in. That can be really difficult for people to achieve. It also can be really difficult for people to access healthcare. Abigail, and we found that, didn't we, in the Transaware Cancer Care project that I know you've talked about on this podcast before. People told us about their difficulties in accessing any healthcare for lots of complicated and some not complicated reasons, actually. And that can also affect the way people can get things like routine screening, but also access support if they've found something that's different in their body.
You mentioned the TACC, the Trans Aware Cancer Care thing, and I know we've all been talked about before. So what involvement have you two had on with that project?
Yeah, I'll go first at threat of the hook. But so we were the community partner on the project, so helping to represent trans people in the design and delivery. And we also did a lot of the recruitment and all sorts of other stuff.
And our job really was to bring the cancer expertise into the room. We were really lucky that we found a cancer nurse specialist to work really closely in the project, bringing all that cancer expertise and that clinical expertise, but also being able to create a bridge really between what we were learning and the people that deliver health services, so they could really reflect on what can we be doing differently so that these inequalities aren't happening. So yeah, that was primarily our role, was to make sure that the messages were being heard and responded to within the NHS.
Okay, so you're here to talk about a particular initiative today. Abby, do you want to start us off with that? And now, is it a sort of a soft announcement? Is that the phrase for it? Soft launch, I think that's
Soft
the
launch, Gillian. Soft
Yeah.
launch.
You marketing types, you see. Okay.
So yeah, we're off the back of the Transware Cancer Care project. Beyond Reflections has been kind of quietly in some places, not so quietly in others, working away on a few different ideas to, as Emma said, kind of address this issue of not only access to cancer care, but access to all care in general. And so Emma and I have been working on one of these to introduce a kind of healthcare navigator within the services that Beyond Reflections offer. And so the idea is to offer a service whereby if people want, somebody can come with them to their appointment, or they can meet them outside the appointment and talk before or talk afterwards, help them make notes, basically anything that they really need to help them access their healthcare appointments.
That makes sense. So Emma, is it just about the trans person, or is there any sort of focus on the healthcare provider in this?
What we know is that a lot of healthcare professionals want to and do provide really good personalised care, but there are people that are really worried that they're going to get it wrong, that they're going to they're not going to respond in the right way to the person in front of them. They're going to feel that they're not doing the right thing. So part of it is also providing an opportunity for healthcare workers to learn more about the trans experience and how that affects their ability to access healthcare, and some of the pretty simple and straightforward things they can do to ensure that the interaction is a good one. So I think it's really crucial. And it was interesting because we did a little exercise with trans people at a conference back in Bournemouth a few months ago, and we asked them what they felt about the idea of a healthcare navigator, and they were really positive that it could really help facilitate their access. Now, it wouldn't be for everybody, and certainly some people would not need it, would not want that. But actually, there's an opportunity for us to provide some additional support to help people get into healthcare, and particularly obviously from my perspective, to make sure that they don't end up having cancers diagnosed much later than they might otherwise have done had they been able to access healthcare at the right time.
Yes. Okay. Very good. So what do we know? Tell me a bit more about this, Abigail. When does it start? How will it work? Tell me a bit more about that.
I think we're starting with a bit of a soft launch, no bells and whistles or cutting of red tape or whatnot. Yeah, so we're kicking off with just one of the people that we already have on the team. One of our wonderful caseworkers is going to be kicking off this role to start with, and I think you're just accepting people via email to say that they want to use this service and going from there. Really, it will be an initial meeting. Let us know that you're interested in using this service, and then you'll have a conversation with Alex, probably only 5-10 minutes, about what you're actually wanting, so what support you want with that appointment, and then just book in the appointment and he'll turn up.
Very good. So is this a service for people who are nervous or have a genuine fear, or because there are other sort of counselling services? So why this? Is it just the fact it's trans and it's run by trans people and has that trans dynamic within it? Or is there anything else? That's enough, but is there anything else part of that?
There's nothing. No, it's just to provide that kind of very practical support. So, that person to be there if there are any issues, or if it's something If you have got something that you're worried about, sometimes it can be quite difficult to keep track of everything that the doctor's saying to you. So to help with notes or anything like that, we do have counselling services and more in-depth kind of group support and peer support as part of what we do. So if people are looking for extended emotional support around accessing healthcare, we can do that as well. But that's not the service that this is launching. This is somebody to just be there with you.
Okay, so Emma, thinking about this, is there any specialist training needed for someone like this? Because I'm guessing there's going to be, obviously, Building Reflections are full of counsellors and therapists and some practical support workers, but is there anything that the team have been skilled up to aid with that general level of competence so they're not just acting as a sort of taxi service?
It's a non-clinical role. This person couldn't possibly, and is not there to substitute a clinician. They're there to help effectively facilitate access to the right specialist. And that might be a nurse in your practice, it might be in your GP practice, it might be a specialist at a hospital, but it is absolutely not a clinical role. There's a number of non-clinical roles already that support people, particularly in cancer. So they might support them through a diagnostic pathway that can be quite complex. They are already delivering some really good work in terms of reducing the inequalities that some people might experience in getting through a diagnosis. So in a sense, this person brings that trans expertise. And what we hope and what we are able to offer is some of the training that our non-clinical workforce would also receive. So some of that would be, we would hope, about cancer, which would be what it is, what the screenings are, and so on and so forth. Yeah. Any adaptations that we've already got or adjustments that we've already got in place, some of the barriers and challenges that people experience. And that's certainly stuff that we found through the TAC project. But it's really, but it could also be about other health conditions that people might need to seek advice and support for. What I hope is that we can really collaboratively work to support the post holder so they feel really confident about going into a healthcare setting, and to be able to provide, as Abigail said, it's just that really practical support. Yeah. And hopefully we'll get some learning, we'll get some data. I'm hoping that it might help us improve things like cervical screening uptake for the community. And I think over a period of time, if we can prove the concept works, it will really help us tell a story about the difference that person-centred care makes to people who are often marginalised from healthcare.
If you're a trans person and you are worried about cancer and would like to access this specific level of support, or if you're a healthcare professional, you're interested in thinking about how you could either learn more about the service or indeed how to improve quality of trans care generally or specifically in this area, what should they do, Abby?
Just get in touch with us via our main email address. It's office@beyond-reflections.org.uk. If you forget it, it's also on the website, or there's contact us forms on the website. I'm sure there will be a web page for this as well at some point, although designing the web pages is usually the last thing on the list to do of things. So yeah,
but this is important to say, this is not a 24, it's not a 365 24/7 emergency service, isn't it? It is part of a routine service that BR offer.
Yeah, so it's not, yeah, call up emergency service. You will need to contact us, like I said, have an appointment or extended email exchange to discuss exactly what you are looking for support with, and then obviously booking your appointment. So yeah.
And will I need to become a Beyond member, or is this service at the moment free to all and sundry?
This is open to everybody to receive this service. We don't want it to be an exclusive service because that defeats the point. And I think we're hoping that after a little while of doing it, we'll get some really good data, as much as I hate to talk about people as data, but that will allow us to get some funding to continue this service.
Brilliant. Anything else to add around other collaborations, around other things that you're doing, screening work, for example?
I think when it comes to listening to people's experiences of care, we do that quite a lot. What we often can be quite guilty of is they're not doing anything with what we've heard. So we are absolutely not in the space where we want that to happen. So at the moment, we're working with one of our local hospital trusts about breast cancer screening and how to make sure that's inclusive of people who may struggle to access that screening. So that includes people who are trans people, but also people with disabilities and neurodivergence, all of whom can experience difficulties in accessing. We are also hoping, I think you're going to be doing some work around what cancer screening is appropriate, working with outpatients, the National Outpatients Charity, just so people are clear about the particular screenings that might be appropriate for them.
Yeah, so that is also supported by Wessex Cancer Alliance, but we're going to be working with outpatients on developing materials to give trans people specific advice around accessing cancer services. I know that they already have this, I think, but it's due for review, and I believe that the current format is that every single screening you could possibly think of is all in one big massive booklet that nobody wants to read. The idea is to break that down a bit and just recheck that all the information is appropriate and accessible again to everybody, and then to hopefully turn that into some recorded content as well, so that people can access that information in a different format, because we know that not everybody wants to read things or can read everything.
Sounds great. Anything else you want to add?
I don't think so.
Abby's famous for just one more thing, Emma, so I'm just going to give you the chance to have the final word, and I'm now muting Abby so you actually get it.
I'm happy for Abigail to have the final word, but I guess the last thing that I'd want to say is that cancer is a scary subject, and I know I started like that, but actually the more we talk about it, the more we learn, and the more we engage with it, the more chance we have of surviving it. I would like us to have a health service that absolutely provides equity of care for everyone, regardless of their identity. So this work is important, really, that we learn from the experts who are trans people, but we also put into action some change and some improvements to try to reduce that inequality, which is not something that we should be putting up with.
And in a world with all this, and in a world where it's so much negative news about trans people and legalities and healthcare and all that stuff, it's really nice to hear something positive, affirming, and something actually that has a genuine potential to really help a lot of people. So that's absolutely brilliant news. Thank you so much for spending time with me today. And beyondreflections.org.uk, I think that's right, beyond-reflections.org.uk, and Emma Leatherbarrow from Wessex Cancer Alliance. Thank you so much for joining me today.
Thank you.
Thank you.